So, I have been working with somebody kind of like on an advocating type thing, and I have an advocating video that was like one of my very first videos on YouTube, and I have to go on the actual full site to pull it up, and I haven't done it yet. But I recently had a issue in the ER, and you know, when I got to thinking about it, well, in this particular instance, there is a different way to advocate for yourself, and I am going to go about this in a completely different way than I have other things. It's not really unorthodox. It's not really a way that some people actually think about doing it, because, well, let's get real, people. People either think about just suing altogether, or they don't think about doing anything at all because they feel intimidated or bullied. So what I'm going to do is just be like, hey, this is a heads up, because this could happen a different way. So let's start back in June. Well, first of all, let's just go back. I had a port placed back in July of 2014, my very first port. I have Crohn's disease, gastroparesis, I have a neurogenic bladder. I have just a huge array of problems. That's just a few of my diagnoses. I have a lot more. Some I don't even want people to know about. Okay. Anyway, so I have had a lot of surgeries. I've had a lot of blood draws. I've had a lot of IVs. After a while, your veins, they have so much scar tissue that they hurt when you get an IV now, or your veins are so small you can't get an IV, and when you do get an IV, it don't take long. They blow, and when they blow and you have an IV in, well, if you have IV fluids running or you have an antibiotic, it infiltrates, which what I mean by that is whatever is going through that IV, it collects underneath the skin, and either your body absorbs it or it just collects. It can be pulled back out, or when they remove the IV, it'll come back out. So I had gotten to the point in a really, really quick amount of time that IVs and PICCs were no longer working on me. I had only had 2 PICCs, and there was no way that the IV team was even going to try to get a 3rd PICC, because the second one, well, she barely even got it threaded. So now I have had central lines, and they were trying to get another central line in. The surgeon that was doing it, I don't know if he was an intern or a fellow. My gut feeling tells me he was an intern, but I quickly kicked him out of my room. He was not going into my groin to try for a central line. Can you imagine having a central line going up your groin and then way up here? No, thank you. So anyway, I did get a port, and it was put in my right clavicle. I had that port for 4 years. I did all the care for it. I did all my accessing and deaccessing. I never had a problem with it. I did have problem getting returned blood. When you push fluids through it, or you're flushing it, it is not uncommon for you to taste whatever it is that you're pushing. So as long as I could taste it, I knew that it was okay. So I did have to get cath flow one time. It did act like it was had either some little blood clots or some, some stuff around it that whenever you pulled back was getting pulled back into the Huber needle. But then I had iron infusions, and that went at such a high rate that it blew all that out of the way. So again, I did not have any more problems. I did not need cath flow again. So in February of this year, I had what I thought could have been an infection. I was put in the hospital and right away given 2 antibiotics at the same time. The ER doctor did not hesitate to give me a vascular surgeon consult, and I was hospitalized for 5 days. At that time, I was given IVs. IVs were blowing pretty quickly. I will put up the hospital stay in the cards during this video when I edit it. At the end, he made sure that my port was working and it was getting good blood return and everything. It turned out that it was not infected. It seemed like I had, they said I had cellulitis of the chest wall, but pretty much it was just like a skin infection. So that was a good thing. So then in the 1st of June, I noticed that the skin over my port had broke open. I had a hole. The hole was over one of the nubs over my port. My port has 3 nubs. The 3 nubs guide you to the middle of your port where you put the Huber needle. And it was draining the yellow-greenish, infection type junk out of it. So I decided I needed to go to the ER because, your port goes up through your carotid artery and over into the top of your heart. That is a mix for disaster. So I went in. They asked me why I had my port. I told them I had no vascular access, and that is the truth. So instead of the doctor checking me out and asking me what was going on, she told the vascular surgeon that I had no vascular access. Not that my port was open and that it was draining yellow and green junk. There was no blood work. There was no consultation. There was an x-ray to see how my port was placed. I had no problem with blood return. The port I could access perfectly fine. It worked completely okay. The port area was very, very tender and tend to hurt a little bit. She comes back and she says, "You're fine." Doctor says to go see your primary care. We'll give you a vascular surgeon to go see. I argued with her. I said, "I have a hole in my chest. It is spewing out, leaking out yellow-green junk. It's infected. That's why I'm here." "Oh, well, just do sterile precautions." I said, "I know to do sterile precautions. I had done the care for my port for 4 years." "Well, but this is what the surgeon says. It's not an emergency." I said, "Okay, well, where is the surgeon? Because he has not done a consultation with me." Well, she continued to argue with me, and I just got really sick and tired of messing with her, and so I got my papers. I get home and I'm looking at the papers. The papers say, "How to care for your port." Gives me all the things that I already know all about the port. How to do sterile precautions, how to access, de-access, all of that. And if the skin over your port breaks open, please come to the ER immediately. Well, guess what, folks? That's what I was in the ER for in the beginning. So, Monday morning comes. My physician's office calls me. He sees if I need to make an appointment. I say no, because This is something that should have been taken care of in the hospital. It has to do with my port, and I have to see a vascular surgeon to have it removed. So I called a number that for the doctor that they give me, because this number is also in with the same group of doctors that I see for my colorectal surgeon. I ask for this doctor. This doctor has never practiced with them. I look this doctor up after I get off the phone. So while I am on the phone, after asking for this doctor who has never practiced with this group, I say, okay, well, I know Dr. DeVity's in with your group. Is he in? He's the one that put my port in the hospital. No, he'll be out of the office for 3 weeks. But I can give you to the surgeon who's taking his patients. And since you're having this problem, we need to get you in now. Thank you. So his nurse got me in the very next morning. I got in, my port was accessed, which it was not supposed to be accessed. I didn't even have to take the stuff off. I started taking the dressing off. He said, you don't even have to do that. He said, do not re-access that port. We don't want infection to go further. I need to take that out tomorrow morning. And I said, I have to have another port. He said, that's fine. It's just, it cannot go on that side. That's fine. So the very next morning, I had surgery. So I was in the ER where they should have given me antibiotics and done blood work because I had a low-grade temperature. I made a phone call to see the surgeon on Monday. Tuesday morning I was in to see the vascular surgeon. Wednesday I had surgery at the hospital where I went to the ER. So, as you can imagine, I was in some pain. I did have some pain medication. I had some Percocets. I had some Percocets left over from my surgery from a year ago in July of last year. I used a little bit of it because I was in more pain than normal from my previous port surgery. There was removal of fat on the left side because this is the newest port, barred power port. And this side, because it had been infected, was really sore too. So, after I made the appointment for Tuesday to see the vascular surgeon, I looked up the doctor that they give me that wasn't with that group, and he was a general surgeon. So, my surgeon accesses my port the day of my surgery. I'm able to do my hydration therapy. It infiltrates. I go, I reaccess, it infiltrates. I go to the ER, they can't access it. I go back to my surgeon, he reaccesses it. On the 7th day, I sit on the line and I pull it out. Then I reaccess it and I finally get it to access and go. I did talk to basically the nurse manager over the ER who acted really stupid. And then I talked to somebody who was supposed to be the chief who was covering basically the nurse manager and the doctor. And she asked me what I wanted. I said, well, first of all, let me tell you about your doctor. I've had her before and she's dismissed me. And I watched her with other patients. She was more worried about seeing however many patients she could see and discharging them instead of listening to them. Well, she said she did a head-to-toe exam on you. I said she didn't do a head-to-toe. She didn't touch me. Well, she talked to the vascular surgeon, and between them two, they decided it wasn't an emergency. I said, well, when you have a hole in your chest and the skin over your port is exposed and open, it is an emergency, and it was infected. Do you not know that this goes up and through your carotid artery and on top of your heart, where it pumps open into your heart? I said, you know, I could have died. well, what do you want us to do? I said, well, you know what? She needs to be schooled. She needs to be taught on how to talk to her patients and how to listen to them. And she needs to learn something on ports because she knows nothing about ports. I said, secondly, I want my copay reversed because you did nothing for me. Well, we did an x-ray. I said, you did an x-ray that was not needed. The port placement was fine. I could get blood returned. There was nothing wrong with accessing my port. My port was in poor shape. The skin was broken on top of it, which made it infected. You did nothing for me in the ER. The doctor ignored me. She did whatever she wanted to do. I should have had a vascular consultation in the ER. Well, what did you expect? To be admitted? I said, yes. That's what should have been done. I should have had blood work. I should have had antibiotics, and I should have been admitted for the next day. Well, what makes you think you would have gotten into surgery? Duh, because I had an infection on my port. I mean, these people are stupid. So I ended up telling her, I said, well, do you know that I can file malpractice on this doctor? Why? Because she failed to diagnose. And that is a reason to file malpractice. I don't want to file malpractice to sue her. I want to file malpractice because she didn't do her job. She was too busy trying to get me in and get me out and to ignore me. She didn't listen to anything I had to say. And I could have died. Then it could have been on the hospital and her too, and her losing her license. So, people, you know, I haven't seen anything. I haven't heard anything yet. But my next step is to contact the administrator of the hospital, to contact the news companies here, Courier Journal, and the medical licensing. Because, you know, people like us with ports, all it takes is an infection. And a bad enough infection can kill us. And doctors like her, like I've had her before, and her dismissed me, and the next day I was admitted into the hospital. They don't pay attention. Well, maybe they need to be suspended for a minute. Maybe something needs to be done, because obviously nothing's being done yet. And don't be afraid. Don't let them bully you, because that's what they want to do. And I guess she thought that I was just going to let it ride, and I'm not. Because the first thing and the only reason why no, this wasn't. I wrote, before I even got a survey, I wrote a survey, and I gave them bad things. And then I called to ask for the director over the department of the ER. Then I got a letter from her boss. I'm going to look on my chart to see, because I haven't gotten any bills. They're not billing me. They're putting them on my chart. And I pay with a check because I want proof that I paid it. So I'm going to look and see if they've erased those bills. But I am going to contact the administrator of the hospital, and then I'm going to contact the news stations and the Courier Journal, and I'm going to contact the medical licensing board if I don't get anywhere with the administrator of the hospital. Because, you know, this is not the type of care that we deserve. This is not the type of care that we need, and these are the kind of doctors that will bully you. These are the kind of doctors that are going to write you off. These are the kind of doctors that are just going to ignore you. So you have to step your ground. You have to stand tall. You have to just not let yourself get bullied. And if you just want to just walk out like I do, not let them think you're not going to do anything, do it. Because they think they've won. And guess what? They haven't. And whenever they get that bill or they get that letter stating, hey, this is what happened and this is why this is happening, I guess maybe you should have listened to your patient, because 2 days after she got out of the ER, guess what? She had to have surgery because you weren't listening to her. There was nothing wrong with her according to you and to the vascular surgeon because you didn't listen to her. You better be glad she didn't die. Because then her husband would have sued the hospital. She would have sued you. He would have sued you. And he would have had your license. So, you know, there's nothing wrong with filing malpractice on somebody. You don't have to sue them. You can just file malpractice on them to put a mark on them. You know, I've had her before. This isn't my first rodeo with her, but, you know, I didn't have to fight over my copay with it because I was right back in the ER and back in the hospital, and it was erased anyway. But, you know, it's not even about my copay. It's about the fact that I wasn't taken care of. It was about the fact that she didn't diagnose me. She failed to diagnose me. She misdiagnosed me, and I could have died. And if I would have went by all this bullshit of this surgeon that she gave me and hadn't been smart enough to even think about, well, you know, the doctor that put this in is in with this group, and I know there's more than, you know, colorectal surgeons. I know there's ear, nose, throat doctors in here. I know there's all these different doctors in here, all these different surgeons in here, so I know that I can find a vascular surgeon in with this group. Then maybe I might still be sick or dead today. So, looking around, trying to find other things, and just being just a little bit smarter than a doctor and walking out and not letting them know that you're going to do something. Google is the best thing. You know, I've been a nurse, well, for over 20 years, and I know nearly 20 years before I had to retire because of my health. And even I Google things. You know, to keep your nursing license up to date, you had to do continuing education classes, and that wasn't including the things that the place you worked for, the hospital, the nursing home made you do. You had to do continuing education courses outside of that, and that still isn't enough. You know, there's still things that you learn, that you Google and do. And so, you know, I've been out of nursing since 2013, and I still Google things. I still Google things today. You know, try better things, try different things. I Google doctors. You know, my doctors, I have the best doctors, and I'm not gonna lie, because I went from my surgeon who gave me my GI, who's giving me my neurologist, and my PCP, who's giving me my cardiologist. So if you get good doctors and you get referrals to them, and you have good doctors and you like your doctors, get your referrals to them. And if you get a bad doctor, make sure before you go, get your medical records. Because if you have your medical records in your hand, what are they going to say? I mean, really. And if you go to a hospital that's affiliated with your doctors, you're charged right there. Everything in it's updated, your medicine. If they want to call you a drug seeker, you know, 27 states are completely, they are up to date and are completely doing the narcotic drugs thing, and it's ran through with your social security number. 11 of them have started it. It's not in full swing, but they still have you in the system. Now that only leaves 2 other states. Leaves 2 other states that haven't joined. So if a doctor wants to call you a drug seeker, tell them to call the pharmacy. They can call the hospital pharmacy. They still have to use your social security number to put you in for a narcotic. And then they can find out if you are a drug abuser. So that's just a little bit of information from me. And as this progresses, I will let you guys know a little bit more. But right now, this is where I'm at in it. And I haven't heard anything for a week, so Monday, tomorrow, I am going to be giving them a call. So I will see you guys tomorrow.